I think we're going to have our questions and comments for Lauren when we do the comments on the first panel. So if the panelists on the first panel, your names are here, if the first panel can come up, I'd appreciate it. If that didn't get you thinking, I don't know what will. It's like a tour of what we are struggling with in terms of this very workshop and the work that many of us are involved in. This first panel this morning really consists of people who have been struggling with what Lauren was talking about, developers who have tested family-focused interventions. And what's important about these developers is that they have struggled to go beyond the stage of developing and testing a family-focused preventive intervention. These developers have all sought to focus the reach of their programs so that they could be taken to scale with fidelity to achieve positive outcomes for children across the U.S. and in some cases the world. They've used different strategies, different organizational structures and processes to accomplish their goal. And we've asked them to describe the strategies, structures, and processes they've been pursuing, the obstacles and opportunities they have encountered, and the results of these efforts to scale effective family-focused preventive intervention. So we're going to get a little bit down into the weeds about what Lauren was talking about with regard to developers who said, yeah, I guess I do have to do the marketing. Who else is going to do it? I guess I better figure out how we get implementation fidelity at scale. Who else is going to do it? And have been pushing forward to try to make those things happen with programs they've developed or been involved with. I've been asked to do the introductions at the beginning. You have people's biographies in the book, and I'm going to do all of them now, and so I'm going to do them briefly. David Olds, our first presenter, is professor of pediatrics, psychiatry, public health, and nursing at the University of Colorado, Denver, where he directs the Prevention Research Center for Family and Children Health. Many of us know his career focused on investigating methods of preventing health and developmental problems in children and parents from low-income families by improving the conditions for pregnancy and early childhood. Primary focus of his work, Nurse-Family Partnership, a program of prenatal and infancy home visiting by nurses which serves socially disadvantaged mothers bearing first children. Today, the program's operating in over 440 counties across the U.S., serving over 23,000 families per year in the United States. David's working with governments in other countries to adapt and test NFP in England, Scotland, Northern Ireland, the Netherlands, Canada, and Australia. He's received numerous awards for his work. His commitment to and completion of 3 rigorous replication trials of NFP with different populations and in different contexts has been exemplary, as has been his careful work to ensure fidelity of implementation of the Nurse-Family Partnership Program and its increasingly extensive dissemination. I'll just tell you, David Olds is one of my heroes. It's an honor to introduce him, but I'm not going to wait to do that until I tell you about the others. Carolyn Webster Stratton, Ph.D., M.S., M.Ph., is Professor Emeritus and founder of the Parenting Clinic at the University of Washington School of Nursing. She's published books for professionals, parents, and children, numerous scientific articles concerning prevention and treatment programs for children with oppositional defiant disorder and ADHD. She's the developer of the Incredible Years Parent, Teachers, and Children Training Series, which consists of over 36 training DVDs used with teachers, parents, and children. She's also received numerous awards. And the Incredible Years parent training programs have been tested in rigorous trials in the U.S. and internationally by independent investigators in a variety of contexts with positive effects on children's developmental behavior. She's created an organization that distributes the Incredible Years training programs nationally and internationally. And to me, Carolyn exemplifies creativity, warmth, and good sense. She taught me that good parenting starts with play, playing with your children. I'm honored to introduce my friend Carolyn Webster Stratton. Ron Prinz, Ph.D., ABPP, is Carolina Distinguished Professor in Psychology who directs the Parenting and Family Research Center at the University of South Carolina. He's the lead editor of Clinical Child and Family Psychology Review, and his research focuses on parenting and family issues, population-based prevention of child abuse, the prevention of childhood behavioral and emotional problems, and treatment of substance abuse issues in families. As you will hear, Ron's work has broadened from clinical interventions with individual families to a broad public health perspective on promoting effective parenting in the population. He was the lead investigator on the CDC-sponsored U.S. PPP system population trial, and he coordinates the research consortium on children and families at the University of South Carolina, as well as an NIH-supported T32 research training initiative. He's also a talented musician, and it's a pleasure to introduce Ron Prinz. Patricia Chamberlain. Patty Chamberlain, Ph.D., is a research scientist at the Oregon Social Learning Center. Her interest in developing interventions for children and families emerged from her early work as a special education teacher. She's conducted studies on treatment for children, youth, and families in the juvenile justice, mental health, and child welfare systems, and she founded the multidimensional treatment foster care and KEEP intervention models. Multidimensional treatment foster care is an alternative to group residential and institutional placement for youngsters with severe antisocial behavior and mental health problems. KEEP provides enhanced support and training to state foster and kinship parents to prevent placement disruptions, improve reunification rates, and reduce child behavioral and emotional problems. Dr. Chamberlain is also doing research on the development of intervention models for adolescent girls in the juvenile justice and child welfare systems that address girls' unique needs. She's involved in helping communities in the U.S. and Europe implement MTFC and KEEP, and is a partner in Treatment Foster Care Consultants Incorporated. I would just add that way back in 1980, when my colleagues and I were developing the parent-focused preventive interventions of the Seattle Social Development Project, it was Patty Chamberlain who continually reminded us of the importance of positive reinforcement in shaping children's behavior with the phrase, "catch 'em being good." Patty will describe the work of scaling up KEEP when it's her turn to present, but let's start with David Olds.